This is Blue Left, a podcast dedicated to amplifying the underrepresented Democratic voices in Tennessee, working tirelessly to bring progressive change to the volunteer state. Here's your host, Peggy Kingsbury.
That's right, friends. From grassroots organizers to community leaders, from urban centers to rural towns, we will highlight the diverse perspectives and powerful voices that often go unheard. Join us as we lift up the blue wave and shine a light on the path toward a more inclusive and equitable Tennessee. Again, I'm your host, Peggy Kingsbury, and this is Blue Lift, where every voice matters. Let's get started. All right. Well, as always, I know I say this every time, friends, but first of all, I thank you for being here. And secondly, I'm really excited about my episode today. I have my friend, Emily Jenkins, with me. And I don't mind saying to the viewers, this is the first time I've done the podcast on a remote situation. So Emily's not here in the room with me. So if you see me looking strange places, if you're watching this on video, you'll know why. Emily is a native of Nashville. We don't have many of those living around here anymore, but she is a native of Nashville. And she obtained a degree from Rhodes College, and then her law degree came from the College of William and Mary. Emily has focused her work on child welfare advocacy and pro bono matters as a solo practitioner. She is now with the Tennessee Justice Center, and we're going to talk about that a lot today. She serves with them as a staff attorney, where she also directs the Healthcare Justice Clinic. And I have to tell you that Emily has a long string of nonprofit work that she has done and is doing. One of her big focuses has been Casa, which is the child. Tell me again what that is, Emily.
And it's, court-appointed special advocate.
There you go. Court-appointed special advocate, which gives children some representation, children who have been abused or, molested, that sort of thing, which is abuse. And that's a wonderful, wonderful group that Emily is part of, and she's in some leadership with them. She's also worked with a hard bargain in our Williamson County area, which helps people with housing needs, and she's active with the Franklin Justice and Equity Coalition. So, to sum all this up, Emily is someone who's super bright, very well educated, a woman of some means, and she is giving back. She's giving back her time and treasure to things that matter, and I think that's super important. And I think it's also your family is engaged in all of that. When one of a duo can do this kind of thing, it means that financially somebody else might be sort of doing a bit heavier lift, and I think it's wonderful when I see couples do that, and I think your couple is certainly an example of that. And anytime any of us are doing nonprofit work, it seems like the whole family's involved because it can really start taking up a lot of time, can't it?
Oh, for sure.
Yeah.
Oh, for sure.
Yeah.
I just launched a child to college this year who informed me before we dropped him off that his goal was to get arrested at a protest. So I thought, that's a pretty good first year of college goal.
Yeah. Your work is well done. Your work is well done there. I've never been arrested at a protest. Have you?
I've never been arrested anywhere.
No, I haven't either. I've done some arresting in my former life as a cop, but I haven't been arrested. I've had some people say to me, you ought to be locked up, but I think that's a whole different kind of thing. And you may know some of those people that say that to me. Well, let's talk about TJC, the Tennessee Justice Center. Tell us what that is and what kind of work y'all are doing.
Yeah, so TJC is a nonprofit law firm. We were created out of a change a couple of decades ago when some people in power realized that the government dollars that went to support legal aid societies was also helping lawyers who sued the government when they were mistreating people in this country. And so there was a desire to stop funding legal aid if they were going to take on the government. And a group of attorneys in Tennessee got together and said, we really need there to be a nonprofit law firm that is not beholden to the people in power and has the ability to do the type of class litigation that legal aid societies are forbidden to do as a result of receiving government funding. So that created the birth of TJC. Gordon Bonnyman helped to found the firm, and he's a legend in Tennessee nonprofits. He's taken on just about any injustice you can think of in the state and usually won. Now, today, our work is primarily focused in the areas of health and nutrition equity. So that means that our main programs that we're dealing with are helping people to access TennCare Medicaid and the SNAP program, which you may know as EBT or food stamps. We also have work on the WIC program, and then we do public policy advocacy around all of those needs, poverty issues generally in the state of Tennessee, and disability access as well.
Okay. Wow. That's a lot of good work that's being done. And I knew some things about TJC, but I never really thought of it in terms of being a law firm. So thank you for clarifying that. That's interesting.
We often say that the way we do our work is a layered approach. So we have client advocates who help at the individual level, helping people enroll in or maintain services in any of those government benefit programs. And then our litigation team does administrative appeal work for TennCare and SNAP cases. And by doing that work, we're able to identify systemic issues. So with these individual client cases, we'll often see that there is the same problem repeating over and over for hundreds, thousands, even hundreds of thousands of people at a time. And that's where our ability to be independent in our funding is allowing us to do the class action cases that really do effectuate systemic change. So, we start at the micro level of how do we solve this for one person, and then it builds upon that to administrative appeals that can then change policies all the way up to our class work that can change it statewide.
Wow. I love that. I love that approach. And you brought up what I really wanted to ask about when we think about the anti-hunger work that you all do and the nutritional support and whatnot. I know that there are a lot of programs out there that a lot of people who are eligible don't access. And I always think, there have been different things where I've had to. So I have a former spouse who's passed away, but one of the things that we had to do was access a lot of assistance for him for various things. And, I'm college educated. I have a computer. I have Wi-Fi. I had time to do it. And it just took a lot to get some of those resources made available to him. For example, he needed a wheelchair that moved on power. He needed needed an electric wheelchair. And there was some help for that because those things are really, really expensive. But to get to the place where I could get the help for that, it took a lot. And I think about often people who are experiencing hunger and poverty, for example, they may not even have the resources to find the resources. And that's where folks like y'all come in. And that's really a problem for us. What are some solutions you can think of so that people who have the need can get access to the need or to the solution?
Well, there are a lot of barriers to accessing programs. Some of it is information-based. So, for example, the WIC program, which is the Women, Infants, and Children program, it supports pregnant women and families with young children in the home. And that is one of the most underutilized programs in Tennessee. And that is in part because people don't understand who can qualify for the program. It's unique in that it is one of the few programs that undocumented citizens can get coverage in WIC to make sure that babies being born in this country are born healthy. And so people not understanding that the program exists, that they qualify for it. The same thing with SNAP. SNAP, what we see is it is sorely underutilized by the elderly population. I think that that's a combination of issues. One being misunderstanding what the program is. I think when you say SNAP, people don't know what that is. Or if you say food stamps, it has a real pejorative context where people don't want to say that they need help.
Which I just hate that. It's the people who don't need that kind of help who have made it have that sort of reputation. And isn't that a real shame?
Yep. Well, and, it's something that I talk about with my clients a lot, and that we sometimes have to have some gentle educating, because I will hear from clients, well, I'm not getting what I need because all these people can just walk into the country and they get everything. And there's a reason why that misunderstanding is so pervasive. And a lot of it is the intentional us versus them stratification that we see on the right of your life is this way because someone took something from you. Mm-hmm. And so, we often have to have with clients, particularly in the Medicaid context, discussion of, yes, it is super unfair that you're having difficulty accessing care, and we want to help you with that. But undocumented people don't qualify for Medicaid. And the reason that you're not able to access services is not because of them. It's because of people who want you to be mad at someone that's not causing the problem and don't want you to realize who really is, which is the legislators that are making these decisions. So there's a lot of real intentional misinformation about programs that's out there. When it comes to the SNAP program, one of the big barriers that we're seeing now, and that a lot of us who work with the elderly are focused on, is post-COVID, the world has changed. I mean, like you and I having this conversation on Zoom right now.
Yeah.
In-person assistance has disappeared. It's not a thing.
And that seems like a convenience for people like you and I, and it's a barrier for many people.
It's huge because you cannot go into an office and apply for TennCare. You can do it over the phone. You can do it if you have access to an online portal, but you can't go to a physical place. With DHS, which manages the SNAP program, they have offices, but good luck and Godspeed to you actually getting assistance there, because they no longer accept appointments. They no longer do in-person interviews at the offices. It's all going through. You can go sit in an office to have your interview phone call, but you can't actually do the interview in the office.
Now, wait a minute.
When you think about
wait a minute. My listeners are going to want a little explanation of that. So you can go to the office, but they're going to put you somewhere and you're going to get on the phone to do your business.
Yes. Part of that is due to a change. They have a decentralized staffing model now where you don't have a caseworker for SNAP anymore. As one of the lovely weirdities of Tennessee benefit programs, there may still be a caseworker's name on your letters, but no one is assigned a caseworker anymore because they thought that made it too easy for caseworkers to assist with fraud. So now everything is remotely assigned to whoever is next in the queue to answer your question, which also means you're going to get a different person every time you have a question.
Right.
But the interview process, which is required to get onto SNAP, and it's required for recertification at least every 6 months, that's via a phone call. And so if you're someone who's homeless, if you're someone who doesn't have phone service, you have to schedule a time to go into an office and have your phone verification to maintain your benefits. And that's a problem that's been huge because SNAP has been understaffed. They did a computer change that threw a monkey wrench into everything. So people would get these letters that say, you will be called on August 1st at 10 o'clock for your recertification call. They wouldn't get a call at 10 o'clock on August 1st. They might get a call at 7 o'clock on August 1st. They might get a call the next day.
Wow.
And if you miss your call, guess what? You lose your benefits.
Wow. Well,
and if you work a job where you can't have your phone with you at work,
then you lose your benefits.
You have to take a day off, take a phone call, And
that may not
if
come.
you're not working, no income. And if you're not working, you also can lose your benefits for not meeting the work requirement.
Wow.
So there's just so many ways people can get caught up and fall through the cracks in trying to access benefits that they're entitled to and that they desperately need.
Right. So, yeah, that makes me, it seems even more discombobulated than I knew. I want to talk a little bit about what's been a hot topic in Tennessee for years, and that is expanded Medicaid. And for the listeners who aren't familiar with what we mean when we say that, so Medicaid is available to people who are at the federal poverty level, which for right now, for example, for a family of 4, I think the latest number is $31,200 a year, that's really poverty. Most states have expanded that a bit and said, okay, if you're 138% of poverty level, then we'll give you some benefits. And so, for example, 138% would be for a family of 4, an annual income of $43,056, which is not near enough for a family of 4 to get by on. But it's certainly a little bit higher than $31,200. So what we're doing in Tennessee is we're just completely cutting it off at the federal poverty level. And then we claim, and you'll have to explain a little more about this, we claim that we have some other state programs that are filling in the gap, but we're leaving federal money on the table that they would give us for expanding this number some. And I'm not exactly sure why. What do you say to that?
I think it's another one of those things that has gotten caught up in party divides and the idea that expanding Medicaid is a Democrat issue, and therefore we have been against it. We will always be against it. We will never consider it from the GOP side. There's just no willingness to even consider it. Heels have been dug in. When you look at the states that still haven't expanded, they're all GOP controlled. Tennessee is one of the last. I think we're down to 6 now in the country that have not expanded Medicaid. And
but
it's in part because
some GOP controlled states are now doing it.
Oh, absolutely.
Yeah.
Absolutely. Yeah. I mean, most are.
Yeah.
I think North Carolina was the last one that expanded. And there's this idea that it's a handout, that it costs the state all this money to expand Medicaid and that we can't afford it. So we're being fiscally responsible by refusing to expand Medicaid. But what you see with the refusal to expand is people going without care, going without preventative care, until they're far more expensive down the road to keep healthy. It removes people from the workforce, which is not good for our state. And it causes there to be a lot of uncompensated care. So when you have somebody who can't qualify for Medicaid and they go to the ER for services, they're going to get emergency services. It's just that the hospital's not going to be paid for them. And then it's going to go against this uncompensated care pool that the state has, or it's going to be bad medical debt that causes all kinds of issues for people already in poverty. And what people don't realize is how many Tennesseans don't qualify for Medicaid at all, because we are very limited in the groups of people who can qualify. So it's not just an issue of the income limits. You have to be what's called grouped. So in Tennessee, the only people who can qualify for TennCare, which is our brand of Medicaid, again, another one of those things that is unintentionally super confusing, because you have Medicare and then they named our state program TennCare, but it's Medicaid. But the TennCare program will cover children, pregnant women, caretakers of a child under 18, and people with disabilities. The only other categories is the breast and cervical cancer coverage. So if you are a man without kids or whose youngest child is over 18 and you're making, you can be working a full-time job, but you're making below 100% of poverty, you don't qualify for TennCare because you don't group, and you don't qualify for a program on the Obamacare ACA marketplace because you have to have at least 100% of poverty to qualify for that. So you can make too little for an Obamacare ACA plan and still not have access to Medicaid because you're not in one of the groups that Tennessee has decided to cover.
Wow. Any idea how many people in Tennessee that takes in?
Oh my gosh, it's a lot. It's a lot. We do have upcoming up on, I think it's October 3rd. It's on our website. We're launching a new data dashboard, which for people who are interested in looking at how poverty affects people in Tennessee and specifically looking at it even down to the county level, we're super blessed to have an incredibly bright attorney who's joined us as an Equal Justice Works fellow. And her program has been to launch this data dashboard that really takes in data from a lot of sources and does it at the county and in some cases even down to the zip code level. We'll look at things like access to health insurance, access to food benefits, looks at how that breaks down on the racial divide of who does and doesn't have care in the state. And it's very interesting to look at where the holes are.
That sounds like that'll be fantastic.
One of the things, yeah. And there's a Zoom launch of it, and I forget the date, but I think it's the 3rd, that will explain how to access the data dashboard and all those things. And it's all going to be free, public facing for anybody who's interested in issues related to poverty in Tennessee. I mean, one thing that I think, says a lot for where we are is you can look at, as a state that has a full abortion ban, how many counties in Tennessee for people on Medicaid lack any OB care and lack a single pediatrician in the entire county. So there are areas in Tennessee where, as a right to life, pro-family state, you can't give birth and have care in your county. You're going to have to drive who knows how long to get care, and you can't get child care or can't get health care for your child on Medicaid in the county.
Wow. Yeah, that doesn't seem very pro-life to me. Yeah. So let's talk about since we're talking about the expansion of Medicaid or the lack of expansion of Medicaid in Tennessee, when we hear them talk about a block grant, what is that?
So the block grant is how Tennessee is funded with the TennCare 3 demonstration. That's where we are right now. And the block grant allows the state to set the parameters for what the services are that we will provide within our version of Medicaid. The TennCare 3 demonstration is unique in that it also provides for the state to have shared cost savings. So where they're able to, sorry, my dog, where they're able to cut services to people and it saves the state money on Medicaid, we get to keep part of that money. So the state has an incentive to keep costs down as part of the block grant process. The current TennCare 3 demonstration was approved by the Trump administration on their way out the door and was approved for a far longer period than demonstrations are supposed to be approved, because the whole idea of a Medicaid demonstration through a block grant is we're going to try and set up our system differently and show that it's a better way to deliver care. And so they're normally time limited to show, okay, this either works and people get more and better coverage, or it doesn't. But the TennCare 3 demonstration is longer than usual and includes some things like the waiver of pre-existing coverage or pre-existing conditions coverage that of retroactive conditions coverage, which normally when you apply for Medicaid in other states, if you qualify, then outstanding medical bills you had in the 3 months prior to application would be covered. In Tennessee, due to our waiver and the limit of retroactive coverage, only pregnant women and children get retroactive coverage. So for people who are at the poverty level would qualify for Medicaid, but apply after they've had, some catastrophic health event, their services that they got before getting on Medicaid, they're just going to have that debt that's going to follow them.
Wow. So, so for the layperson, basically the federal government says, here's the chunk of money that we would spend in your state on Medicaid. We're going to let you spend it, and you get to make the rules. And if you save some money, you get to benefit from that.
Yes.
Geez.
Now there is a rulemaking. CMS does still have to approve what the demonstration is going to be. And when they make changes to it, they have to get approval. I will say there were 2 positive changes that were made recently. We'll give TennCare credit when due. One of which was that starting June 1st of this year, they expanded financial eligibility for the relative caregiver category of TennCare, which is parents who have a child under 18 in the home. It used to be that capped out at about 82% of poverty, I believe. Now it goes up to 100% of poverty, which brought in coverage for a lot of families that were in what we call the coverage gap of made too much for TennCare Medicaid and couldn't get on an ACA plan. The other thing that changed this year is they added a diaper coverage benefit, which is unique. Tennessee is the first state to do that. It goes for children up to age 2 and provides up to 200 diapers a month. It hasn't had the smoothest start, just started in August, and you have to get the diapers through approved pharmacies, and the network just hasn't quite gotten up and running. But that is a positive thing that came out of the demonstration changes. So we want to applaud those changes when we get them. There's another change that's proposed and in the works, but has not yet been developed, which is to create a working disabled program for home and community-based services, which is things like your private duty nursing and attendant care, those programs. You can qualify for those if you're physically disabled, that's the Choices program, or if you had an intellectual or developmental disability before 21, there's the ECF Choices program, both of which provide really critical services to people with disabilities, but are also income limited. So this new working disabled group that's being developed would allow people with income over the eligibility limit to buy in to those programs and access those services through paying a monthly premium, which, it's going to take some time to figure out what the parameters for who qualifies, what the premiums are going to be, and what the service model will be. But that's good news coming for a lot of people with disabilities who want the chance to work and support themselves, but also critically need access to care.
Right. Well, and I'm sure I'm sitting here thinking, and I know my listeners are thinking as well, it's all very complicated. Is there a place where someone can go or can take someone who is struggling, whether it's getting their health care paid for, making sure their bills are paid, feeding their children, taking care of a disabled family member? Is there a place where someone like that can go and sit down with someone and say, I've got all these issues. Is there anything I'm eligible for?
There's not one place, unfortunately. There are a lot of places, but there's not just one. So at TJC, we help with initial applications for TennCare and the Medicare savings plans. And then we help with issues with renewals and recertification for the SNAP programs. Second Harvest helps with SNAP applications, initial applications. Family and Children Services helps with ACA marketplace enrollment if you need to enroll in an ACA plan. And there's a program called SHIP, which is the State Health Insurance Plan program. I always forget what the P stands for. The SHIP program is one that we always recommend to anyone who's on Medicare, because it is a program that will assist to select what the right Medicare program is for you as far as Part A, Part B, Part C, Part D, the Medigap plans, all of those things. And it's a non-commissioned site. So they just help give you unbiased. They look at what your providers are, what kind of services you're using, and help you make sure that you're doing the right thing and selecting a plan that's going to give you the most if you're Medicare eligible.
That's a good one. That's a good one. It does seem, though, doesn't it, that we make it really hard for people to find out where benefits are that would truly make their lives better and more healthy.
Oh, absolutely.
Yeah.
Absolutely. And for example, one of the barriers on the SNAP program is just the way that they have their online system set up is that you either have to choose, I want to get all my notices in the mail, old school. I don't use computers, send me everything on paper. Or you can get on their portal and submit verifications and other things you have to do through the year to keep your benefits. But if we have an elderly client who comes in and needs help, we can't help them on the portal because if we do, it turns off their letters. So we can only help them by old school faxing documents to DHS, which take days to get uploaded and sometimes never get uploaded to the right place. So, for people who need that assisting person, they kind of have to choose. If I take on and get an assisting person, then I'm not going to get anything in the mail for when I just have regular things I need to know about my coverage.
Good
it's
Lord.
Very frustrating.
Good Lord. Well,
yeah.
And, and my theory is, and it's probably more than a theory, but I do strongly believe that then what happens is we have a lot of this benefit money left on the table, and then that causes some politicians who want to make out like everything is roses say, look, our state's in such great shape, we've got all these benefits, but we just have people, we really don't have that many people that need these things, which is not true at all.
In particular, I don't understand why the state puts so many barriers up because the state doesn't pay for it.
Right.
That's fully federal funded. So I don't understand why we make it so hard. We've had in the last year a real rough time with SNAP applications where the federal rule is you're supposed to be benefits in hand in 30 days because it's an emergency food support for people who really need it. People have been waiting 3, 4, 5, 6 months for benefits because the application process has fallen apart in the last year. They're starting to get caught back up, but now all the people that they caught back up on initial applications are running into the same barriers with recertifications, and they're all losing their SNAP approval again. So, yeah, there's just a lot of things that make it hard for anyone who needs help to figure out where to go.
Wow. And, I know it's something that, and for listeners to know, Emily and I are friends as well. I know it's something we've discussed, but I feel like our legislature in Tennessee spends a lot of time passing laws to take something away from somebody, and they spend very little time thinking of how they can help Tennesseans who need help and assistance. And that's pretty frustrating.
Well, even when they do start a program or expand a program, it's not often done thoughtfully. One example of that would be there's a new program, relatively new, that's called the Relative Caregiver Program through DCS. And what it is designed to do is for family members, granny, auntie, uncle, whoever, who take in a child who can't safely stay with their parents. And it's not through foster care, but they just say, yes, I will take the child to make sure they're safe and well cared for. The relative caregiver program will pay 50% of the foster care rate. So where foster care would pay $30 a day, relative caregiver provides a $15 a day benefit, which really helps with somebody who's taking on the cost of raising a child that's not their own. The problem is the way that it's paid. In Tennessee, it's paid, and the people who get the support get a 1099 for it. So what we're seeing now is people who get this benefit to help them offset the cost of raising this child are losing their SNAP benefits because SNAP considers it to be income. They're losing eligibility for Section 8 housing because it's making them income ineligible.
Oh, my Lord.
So those are the kinds of things that people in poverty really face almost insurmountable barriers in understanding, if I do this program, what is it going to cause to happen in this program over here?
Right.
And so it can be really, really tough to figure out how to help somebody who has, a complex situation where there's people in the house with disabilities, there's people in the house who are living below poverty, there's people in the house who, are being taken in as a relative. So it's really, there are a lot of ways to fall through the cracks or be pushed through them in Tennessee.
Right. Well, and I have a history of being a caregiver, and I know that, if we live long enough, most of us, the vast majority of us, will either be a caregiver for someone or need a caregiver ourselves. And I can tell you that in my own situation, I, thank goodness, had the financial means to pay someone to come in the home and render the caregiving so that I could go to work and make a living. And I had control of my own time in my job. So I was able to doctor's appointments and all that stuff, make sure that was done. And I've so often thought about people without the financial means to pull that off. I mean, families just completely fall apart sometimes when something like that happens, especially if it's the main earner who now becomes disabled for one reason or another. And it's a very difficult situation. And I also believe that that caregiving is a profession and an area of not only our government, but just of commerce, where we don't compensate people very well for that either. And people don't want to do the work.
Caregiving is an area we have a lot of concern about. We have a public policy initiative that we've been working with the Disability Coalition, the ARC, and other nonprofits engaged in disability work around changing Tennessee's rule about paid family caregiving. Because right now, the paid family caregiving in other states will allow a family member to deliver those same kinds of services that the state will pay for through home community-based services. If a family member can do that, they'll allow the family member to be paid instead. Tennessee is very limited in the situations in which someone who lives in the home can be paid to deliver the services for the person with disabilities, which it causes a lot of financial hardship. But the other piece that we see a lot is, even setting aside who's paying for the care, there's a huge caregiver shortage in Tennessee, particularly for our people who live in rural communities. There just are not staff available. So, we had a client in Jolton who we have contacted all 31 agencies in Nashville that staff, and not one would accept the case. So even though they are disabled, they've been approved for Medicaid funded services, they're going without care because our rates that we pay for caregiving are so low that people don't want those jobs.
Right.
And so it's causing huge hardship.
It does, and it's a real gap in the way that we show that we don't really care about people. And as we baby boomers age, we're going to see more and more instances where either we're having to care for parents or our children are having to care for us, that sort of thing. I want to talk about an interesting case I know that TJC's been involved in. That is AMC versus Smith. Tell me why that came about and what's happening.
So AMC versus Smith is a class case, and it has been going on since right before the pandemic. And it involved a lot of the issues that some of them pandemic related, they got much worse, and some of them are just systemic breakdowns in the TennCare system. But it involved people not getting notice and not getting renewal packets prior to being disenrolled from TennCare, which there were problems with that before the pandemic. But then when the COVID pause on requiring people to renew their coverage was lifted and TennCare had to recertify for eligibility everybody on the program at once, the system fell apart. And so there were thousands, hundreds of thousands of people, lots of them children, who lost access to care because the renewal process itself is so flawed. There also were issues with disability access. So people who needed help with their applications for TennCare didn't get the help that they needed to maintain their coverage. There were issues with the computer system. Deloitte did the computer system for TennCare when they did their last update, and it caused huge problems in failing to properly screen people for eligibility, which continues to be a problem. It's a problem nationally in many states where Deloitte did the eligibility verification programs. And then there were problems with the process to appeal when you've been wrongfully terminated. So TennCare had a policy that if they said, you don't qualify for our program, and you couldn't give them what they considered to be a valid factual dispute, you wouldn't even get a hearing to protest being wrongfully terminated from coverage. So we had a trial last November, and we did just have a decision in the case where the court said that TennCare had violated the rights of thousands of enrollees. And right now, where we sit is the judge has ordered us and TennCare to go to mediation to see if we can agree on the remedy for the violations. And we were very fortunate. We've had a great team, Celindy and Gay and the National Health Law Program, who all came together and worked on this case to fight for the rights of Tennesseans.
Wow. That's important. And I think the implications really are more broad than just this one case. I think hopefully the implications will be that the state better tighten up how it runs its programs. And if people are eligible for something, they better make sure that they run a pretty tight ship. Because, you know, if, I don't know, let's say our legislators' paychecks were delayed for a month because of a computer glitch, well, they'd be all over that, you know. So, I mean, I think there's a... Go ahead.
There's real life consequences when someone goes without care and experiences, you know, a medical emergency that then doesn't get covered, and they're then coming back onto the TennCare rolls sicker and sometimes with irreparable damage. So this is more than just, you know, an on paper, oops, we messed up, sorry, worker error. People's lives are genuinely in the balance when TennCare gets it wrong.
Right. And so you have a large segment of the population that says, for example, you know, from a woman's perspective, well, I don't have any coverage. I know I need a mammogram. I feel a lump. Oh, well, I'm just going to have to let that go. And then, you know, that can be obviously catastrophic. And for people who like to think about money all the time, that gets into everybody's pocket, because then when the sick get sicker, we do eventually take care of them. And all of us end up paying for that.
I will say in that example, one program that I think is sorely underutilized in Tennessee that people don't know about is the breast cancer coverage for TennCare Medicaid. So people who are not on TennCare can go to their local health department and get a screening for breast cancer. And if they are screened and it's positive that they have breast cancer, then they get presumptive coverage that day for their breast cancer treatment. And then as long as they then follow up within 30 days with a written treatment plan, then they can continue their Medicaid benefits. And the financial eligibility for the breast cancer coverage is higher than it is for the other types of Medicaid. So breast cancer and cervical cancer, both, there are screening programs because the state recognizes that we need people to go to the health department and get these screenings and get care started early, because the longer you wait, the less likely your survival and the more expensive your care. And I'll give TennCare the positives when they got them. It used to be that the breast cancer coverage was only for women. Now that has changed, and now it is for anyone in the state of Tennessee who has breast cancer, because men get it too.
That's right. That's right. Well, and I also, I'm thinking that we need to expand that and add colonoscopies to that, because those cancers are so easily treatable if they're found early. And, I know that's not something everybody wants to hear about on a podcast, but, it is something that people who don't have health insurance are not even going to think about going and getting that done. And if we could offer that through the health departments, that would be amazing. And it would help a lot of people. Well, this has been a good conversation. I mean, the work that you all are doing is so important. And it's just, when we think about people who are struggling, they can be struggling in lots of areas. They can have an income struggle. They can have a health struggle. They can have also a disability playing in there somewhere. And we have ways to help many, many people. We just don't make it very easy for them to get the help. And then in Tennessee, we somehow decided we don't really want to offer some of the help that's there that the federal government would pay for. So it's almost like we're just throwing tax money away in that case, because all of us who work are paying tax money for people to have these benefits, because that's how a democracy works. But yet we're just in Tennessee willing to say, oh, well, never mind, just let it sit there. The money just goes into this black hole, and I don't really understand why we do that.
Well, if you ever want to spend a day or find somebody on the podcast to talk about it, the TANF funds in Tennessee, that's one of our primary areas where I would say we just are sitting. I mean, we have the worst record, but where those are funds that really can provide vital care to struggling families, and Tennessee has decided to just not spend it. We're just going to sit on it.
I know. You're right. I do need to have somebody talk about that. That would be a good topic. What is on what big issues on the horizon for TJC?
There's a lot. It's the continued issues of what's the remedy coming out of AMC, of how do they change the program to make sure that people have an opportunity to participate, and that the system is set up in a way to keep people enrolled in the care they qualify for. We're always pushing for Medicaid expansion in Tennessee. That's a big one. Looking for ways to get the legislators to expand some of the programs that are numerically capped. So like when I talked about the choices and ECF choices programs that provide home and community-based services to the disabled, those are amazing programs, but they're full. So the caps on those programs being raised would provide coverage to a lot of our most vulnerable in Tennessee. And on the SNAP side, we're really concerned about the delays in application, the problems with notices, and with people being wrongfully terminated during renewal. So that's something that's very much on our radar right now, is people are going without critical food services because of program inefficiencies at the state level.
Wow. Well, that's a lot of important work. And I have to say, again, how much I appreciate what you're doing, and I know a lot of other people do too, because I know you could take your fancy law degree and go to a big fat firm and make a whole lot of money and, wear the fancy clothes and drive the fancy car. But you've elected to use your skills to serve others, and that is something that we don't see near enough of in the world. And I know also that it can be emotionally taxing work too when you're around people all day who are struggling. I did some work for legal aid during the pandemic when I just had some extra time, and I worked the phones for them. And the issues that I would hear people having, where they literally were at the point of sleeping in their car because they, again, as we were talking about, couldn't get through the maze of red tape to get help with housing or various other issues, and lots of families who were experiencing elder abuse and that sort of thing. And so I know how taxing that can be, and I really appreciate what you're doing. If someone wants to learn more about the Tennessee Justice Center, where would one go?
You can go to TennesseeJusticeCenter.org. We also have an annual gala coming up on October 17th, and that's going to be a great night because we get to celebrate some of our warrior parents and loved ones who are really fighting for their children's rights. There's always a lovely thing where some songwriters come in and help some of the moms caring for severely disabled kids write a lullaby specifically to their kids.
Oh,
and
wow.
then they perform it at the gala. So it's a very heartwarming night to look at the work that we're doing. So there's still tickets available for that if you want to support TJC. And then, like I said, if you go to our website, you can see our upcoming events. We do a lot of webinar trainings if people need to know things about accessing services and programs. We have the upcoming one on the data dashboard that's tracking poverty in Tennessee. And you can sign up for our newsletter and see what's coming up. And if you happen to have a child or loved one in college who's interested in doing a summer internship, that's a huge support for our work. Is we bring in summer interns that help with our casework, and I can tell you they will not have a more hands-on, rewarding internship experience than they would get at TJC. So those opportunities are on the webpage as well.
Wow. Thank you so much for that. Those are a lot of good ways to find out what you all are doing, and then also get involved. And I know kids are always looking for internships. Well, thank you very much, Emily, for being with us today. I really, really appreciate it. And I know that the future will probably hold lots of good trouble for both of us, because we seem to be able to get in some good trouble sometimes together, and it's extra fun when it's together. So I thank all the listeners to Blue Lift, and you can like and subscribe to my podcast and make some comments. And then my website is blueliftpodcast.com. So thanks, everybody, and have a great day.